Fabian Kretschmer joining us there from Beijing. Thank you. And joining me now is Dr. Mohammed Munir, a virologist at the Lancaster University in the UK. Thank you for your time. Firstly, what is driving this particular surge of COVID in China?
I think there are multiple reasons. I think one of the major reasons is that the overall vaccine coverage has been very low, and particularly in the age group, which is more vulnerable. I mean, only 40% of people with 80 and older have had the third dose, which we know that is not going to provide enough protection as well. So fourth dose is required. And I think one of the major things that China has done is that although they've been practicing like 2.5 years of stringent zero COVID policy, but during this time, they haven't really prepared to tackle the situation that they will come across soon after lifting the zero COVID policy. And that abrupt change has really put the country at this situation.
And how much of it is also related to claims that the Sinopharm vaccine is not as effective as it should be?
Yes, absolutely true. Particularly when we say about the variants up until Delta variant that have been infecting into the human population, the overall efficacy of the Sinovac and Sinopharm has been very low. And then it has not been tested, and overall reliability of these vaccines, homegrown vaccines against Omicron variant is not really yet known. And in China, majority of the variants that are circulating belonging to the variant of Omicron. So given that the vaccines are not really highly efficacious compared to, for example, mRNA-based vaccine, then the coverage is low. Omicron is spreading, which is more infectious. And then the winter, that is the perfect timing for these kind of viruses to spread into the community.
Are we likely to therefore see a return to harsh COVID restrictions?
I think what China is probably doing is instead of having a draconian measures or having a zero COVID policy versus complete relaxation, they are going more with a dynamic zero kind of policy. And that policy is that instead of having a lockdown at the city level when a couple of cases are arriving and then testing all of them, having the area where the positive case has been detected to put into the restriction. But I personally feel, based on my virological experience and going through this pandemic like any other virologist have been doing, three things need to be done. First is the fourth dose of the vaccine need to be introduced quite quickly and need to be amplified. Mask mandate need to be put in place, which I think in China, majority of the people, they do wear the mask. And thirdly, more importantly, some level of restrictions need to be put in place at this moment to flatten the curve and then slowly relaxing it down and amplifying the vaccination campaign. Without that, I think the overall impact of this particular wave would be enormous.
Dr. Munir, thank you very much for your time.
Thanks.